Assalamu alaikum wa rahmatullahi wa barakatuh, and good morning, everyone. I'd like to welcome you to the second National Institute for Health Specialty Accreditation Surveyors webinar. And I hope that you can all hear and also see the slides. And if you have any questions during the next 3 hours, please feel free to type on the question and answer, and we will be getting back to you. We'll also have a time at the end of the presentation to answer your questions. Let me introduce myself. My name is Dr. Mohammed Al-Rawhani. I'm Associate Professor at College of Medicine, UAE University. I'm also a respirologist and sleep physician, Secretary General of the National Institute for Health Specialty. So today we have a very rich program where we will be talking about the NIHS accreditation standard, accreditation form and rubrics, how to conduct an institutional site visit, how a decision is made, and some question and answer. And we have really excellent speaker. We have Dr. Sheikh Badr, who's an expert at the NIHS. We have Dr. Moses Subusi, who's heading the accreditation subcommittee. We have Dr. Mariam Al-Marashda, who's heading the surveyors subcommittee. And we also have Wafa Al-Ulakhi, who is really putting everything together, and she'll have also time to talk to you. I'd like to welcome you all again, and let me start with a quick introduction about the National Institute for Health Specialty. So to start with, is the National Institute for Health Specialty was established by a cabinet decree number 28 of 2014 as a national institution mandated to regulate and organize professional development for the health workforce, with a particular emphasis on specialty training. The NIHS is nested within the UAE University, the premium national higher education institute in the country, and is governed by a high-profile board of directors chaired by His Excellency Minister of Education. Our vision is to develop a highly qualified health workforce able to support the health system and promote health and well-being. Our mission is to set and maintain a high professional standard towards strengthening the health workforce capacity and promoting health. Our strategic goal is to build up a strength and strengthen the institution governance of the institute, and also to work on strengthening the specialty programs for health professions, to develop a robust accreditation system and an effective assessment system. So where we are with the governance, we do have a National Institute Board of Directors chaired by His Excellency, the Minister of Education. Members are all executive from all the health regulator. We have a board advisory committee, and we have also the specialized scientific committees. So far, we have 20 specialized scientific committees across the boards from medical, dental, and allied health. We have a Council of Scientific Affairs, which is made by the chair of the specialized scientific committee. We do have also a Central Accreditation Committee, and we will be talking more about the role of the Central Accreditation Committee today. And we have a Central Assessment Committee. Our partners are all the health regulators in the UAE. We have the Ministry of Health and Prevention, Dubai Health City Authority, Ministry of Defense, Department of Health Abu Dhabi, Ministry of Education, UAE University, Dubai Health Authority, Saha, and Emirates Health Services Establishment. Now, why we're talking about accreditation? Because it's an essential part and pillar of the specialty education in health. It identifies strengths and gaps in our programs and your programs and the processes. It fosters a culture of quality and safety, and improve patients' outcomes and mitigate risks. It also supports standardization and harmonization of specialty education and ensure accountability of specialty education for both institutions and programs. Now, the central role of the accreditation surveyors, they are the essential asset for the accreditation system, the human tool to operationalize the accreditation system and standards. They are an aid to quality improvement and capacity strengthening for institution and program. They support continuous improvement of accreditation system through feedback and reflective practice. And they also disseminate knowledge and expertise and prepare the future generation of surveyors. Now, I'd like to invite you to visit the National Institute for Health Specialty website because it has a lot of information, and I'm showing you a quick video of the application to the institution accreditation. Now, I hope that was a very quick introduction about the National Institution of Health Specialty. Next is I'd like to invite Dr. Sheikh Badr, who is a policy development expert at the National Institute for Health Specialty. Dr. Sheikh will be talking about the NIHS accreditation standards. So, Dr. Wafa, it's up to you if you'd like to share the slides from your side, or if you'd like me to continue.
Assalamu alaikum. I'm glad to take you through a journey, an overview of the accreditation standards developed by the National Institute for Health Specialties. So next slide.
The slide can be just in show mode. Dr. Muhammad, maybe you and or Wafa who's conducting it.
Is it clear now, Mariam?
Yeah, just put it in a slide in the show mode.
It is.
Yeah, okay.
Yeah.
Okay, so just reviewing how accreditation is defined, and I'm sure there are many definitions, but this one make it clear as to reference to the standards where accreditation is seen as a process of formal evaluation of an educational program, institution, or system against defined standards by an external body for the purposes of quality assurance and enhancement. I found this description as comprehensive, and here it refers to the presence of defined standards. So next. And the quest for accreditation is actually obviously felt globally and it's becoming as a requirement in undergraduate medical education. And I'm sure most of you know that the ECFMG in the United States has stated that by 2023, they will not accept medical graduates unless they graduate from a recognized medical school. And by recognized medical school they mean that a school that is accredited with standards comparable to their standards or the standards set by the World Federation for Medical Education. So that has given momentum to accreditation in the domain of undergraduate medical education, but also accreditation is gaining accelerated momentum in residency education. And we are seeing diverse systems and practices that are emerging globally. And there are many examples of these. And accreditation is linked increasingly to competency-based education and competency frameworks. Next. So Dr. Muhammad has already touched on this, the benefits of accreditation, and I'm sure we all feel that it's a very powerful tool for quality assurance, and also it facilitates improvement in institutions and programs. It stimulates change, and it enhances transparency as well as accountability, and it contributes to improving the health outcomes. And this is the final goal of any educational program or even health systems. Next. Now I would like you to see the place of the standards in the accreditation system. In any accreditation system, we have 4 pillars. We have the accreditor, which is the agency that is mandated to accredit. We have the accreditee, which is the institution or program that apply for accreditation. And we have standards whereby we measure the quality of the applying institution or program. And then we have a process of applying these standards. So my focus will be on the standards. Next. The NIHS accreditation standards are developed based on 3 levels. We have institutional requirements, and then we have program requirements and specialty specific requirements. The institutional requirements and program requirements are classified as general standards that should apply to any institution that's seeking accreditation by the NIHS. And the specialty specific requirements are the detailed standards that are developed by each specialty to ensure that resources and everything pertaining to the specific specialty is also available. So next. The standards development process we adopted included reviewing the international literature pertaining to accreditation, and there are practices such as the ACGME, the Canadian, the British, and other examples. So we managed to review all those experiences, and then we contextualize to the UAE context and the regional context, because this is highly needed as the international standards are developed in different or other contexts. And then we benefited from residency experience in UAE. And in fact, even before the establishment of the NIHS, there are residency programs in different hospitals in the country here. And they have also very useful experience over the last period. And the standards, when developed by the NIHS, are also subjected to broad stakeholder participation, consultation, review, and then finally they are approved by the NIHS academic structure, including the Central Assessment Committee and the Council of Scientific Affairs. Next. So the general structure of our standards in the NIHS, they are structured around 5 main domains. The domain of governance, whereby we review the oversight, the management of residency within a certain institution, how the structures of governance and management are set up, and how they are operating and how they are functional and effective. Then the educational environment, and this includes a set of dimensions that are measured to ensure that the residency program happens within a conducive environment to quality and to excellence. And then we have the dimension of the trainees, which is very important dimension, the residents themselves. All that relates to their recruitment, their training, their needs, and all sort of things relating to residents or trainees. And then the fourth one is around trainers or faculty. All around faculties, starting from the recruitment to their role, to the time allowed to them to participate in the training, their development, and other aspects pertinent to the faculty. And finally, we have a dimension of continuous improvement and innovation, whereby we try to see how the institution manage the continuous quality improvement and innovative practices. So these are the 5 structures around which the NIHS standards, whether for the institution or the program, are built. Next. And now coming to our approach to measurement. How we use the standards, and this is very important for accreditation surveyors. First, we have the principle of wide and balanced coverage of relevant domains. The 5 domains I have shown, they are all covered in a balanced way in terms of the details that comes under each one of them. And then we also emphasize the minimum requirements. These standards are set to actually focus on the minimum requirements. Therefore, institutions can exceed these standards. But of course, it's not acceptable to have something lower than these standards. And we allow, therefore, room for excellence by institutions. And the standards are largely objective, including measurable requirements. And then they also allow room for institutional autonomy and innovation. Our standards are not restrictive in any way. And then most importantly, they involve, besides the quantitative dimension, they involve qualitative dimensions. And this is very important because it allows for judgment by accreditation surveyors. So while we have a tool which will be shown to you, which is accreditation rubrics to be filled, but again, the qualitative dimension is very important, which is the overview by accreditation surveyors, their opinion about the institution, and the reflection about the visit and about the areas of strengths and areas needing improvement. Finally, our standards come in 3 levels in terms of the rubric. whereby we need accreditation surveyors to state that whether the institution has met completely or partially the requirements, or if the requirements are not unmet in any part of them. Next. Finally, application of the standards. As I mentioned, we use a comprehensive approach. We adopt quantitative and qualitative approaches. We have a stipulated process and procedures to apply our standards, and this will be discussed with you through this workshop. And we have standardized tools. Example, our rubrics. You will also be taken through the rubrics. And we have the human tools, which is you, the participants in this workshop, and as accreditation surveyors. And I think accreditation surveyors are the most important part of our accreditation process, because the human tool, although is described in research terms as not standardized, but the human tool is reactive and is inclusive, and the reflections provided by accreditation surveyors when they conduct the site visit are actually very useful for us to evaluate an institution. Lastly, we also learn from feedback, and we are aware of focusing on improving our system along the way and learning from feedback. And the feedback is an important dimension in your work as accreditation surveyors, because you also provide feedback not only around the institution you visit, but also around the whole process, including our standards, including our procedure. If there are any observations from accreditation surveyors, that will be very useful for us in the Institute for future growth and future development. Thank you so much.
Thank you very much, Dr. Sheikh. That was really excellent overview of how we come up with these standards. Next, I'd like to welcome Dr. Mose Subusi, who's a consultant psychiatrist. She's chair of Behavior Science Institute in Al-Ain Hospital, Saha. Dr. Mose is also heading the accreditation subcommittee, and she will be talking about the accreditation forms and rubrics. I think she may want, or Wafa would like to share the slide from her side, so I will stop sharing. And if you like, Wafa, now to share the slides, Dr. Mose and Dr. Mariam slides.
صباح الخير.
صباح النور, مرحبا.
Thank you very much, Dr. Mohammed. Good morning. I hope that you can hear my voice.
It's clear, Dr. Mose.
Yeah, thank you very much. So today I will be presenting about the work which we did under the subcommittee of the Central Accreditation Committee, which is focusing on issuing the forms, the application forms. So the very first, I would like to discuss about the phases of the accreditation. First of all, the accreditation should be going through two phases or two waves of accreditation. The first one is the institutional accreditation. And that is in this accreditation, the focus will be on the sponsoring institution. The lead for the application will be by the designated institutional official or the DIO. There are two forms to be filled, the sponsoring institution information form and the institutional rubrics. The second phase of accreditation, so once the institution is accredited with what we call it الاعتماد المؤسسي, once the institution was surveyed and accredited, then the next step, the institution, they can start applying for the specialty accreditation, and this will be assigned in a separate site visit. So for the specialty program accreditation, this will be led by the program director of the specific programs, and under the guidance and the oversight of the DIO. The program director of the particular program, let's say internal medicine, she or he has to fill the common program information form, which we call it the common BIF, and the specialty program information form, which we call it the specialty BIF. As well, they need to fill a specialty rubrics, which is a kind of a self-study format. We had, can we go to the next slide, Wafa? Yes. We already, there are actually eight programs, specialty programs, which are ready to go right now. Of course, there are other programs on the pipeline. I assume maybe Dr. Mohammed will can elaborate on it later. But right now we have 8 programs which are ready to go: the ENT, psychiatry, pediatric surgery. The next slide. Internal medicine, emergency medicine, obstetrics and gynecology, as well family medicine. And for all of them, we prepared the BIF and the rubrics. So now we will show just a sample of these forms. The forms will be available in the website, but we will show you just a sample of these forms. We will start with the institutional application form. Can we start, Wafa? Yeah. No, I just see the slide right now. I don't see the form. Yes. So this is the first, which is the with regards to the sponsoring institution, application for the institutional accreditation. So there are at the beginning general information about the institution. Information about the program, specialties, subspecialties, participating sites, institution leadership, vision and mission, institutional review questions. Training and facilities infrastructure, support services, clinical support services, clinical facilities, clinical governance committees, institutional committees, policies and procedures. And now about the graduate medical education, information about the programs in that particular institution. Yeah, and if there is any major changes in the institution and the response to previous institutional citations. And here I would like to focus on the appendix. The appendix include a lot of attachments, which is required to be submitted, including the license certificate of the institution. And if there is any accreditation letters, like for example, from the GCI, the ACGME, ACGMEI, ISO, etc., organizational chart of the sponsoring institution, organizational chart of the education department or academic department, GME membership, the GMEC membership, including also terms of reference of the graduate medical education. Also, we need the minutes of the GMEC meetings, and also if there is any affiliation with any medical school, if there is any any affiliation agreement document, a job description and the CV of the DIO. Also the policies manuals and the annual grad medical education reports. So these are the one required. As well, we need the institutional commitment statement from the C-suite and the delegation letter signed by the DIO in case of his or her absence, and also the contract of the resident, as well the internal review form and any related protocol or policies to the internal review. And then this document needs to be signed by the DIO or the chair of academic affairs. So we'll go to the next form, which is the rubrics, the institutional rubrics. Yes, so this is the rubrics. Again, it touch base with all of the same, components of the form. It's like a self-study, which helped the DIO to prepare the different documents and touch base with the policies and so on and so forth. So the first domain will be about the governance, the governance structure. And for every question, there is probably you need to provide, you need to identify whether you met, partially met, not met, and you need to identify if there is any evidence of, if you say, for example, I met it, then probably you are required to provide an evidence, whether a policy or some sort of a document or template or audit tool or whatever. You need to provide an evidence for if you said that this domain or this standard was met. Can you scroll here down? Also about the governance relationships, governance process, training environment, the physical setting and infrastructure, clinical governance and practices, learning, training resources, positive learning culture, recruitment and deployment, and then about the competency acquisition, training procedure, resident support and growth, faculty and administrative staff, including scope and recruitment, support and growth of training team, performance of the trainers or the faculty, continuous improvement and innovation, including the internal review process, quality improvement, culture and system, change and innovation as well. And then it needs to, and then you can give the overall assessment for the fifth domain, and then to be signed by the DIO. So this document should be helpful for the DIO once they are applying, just for them to reflect on their application and make sure that they are fulfilling the required before they go forward. The next form will be about the common program information form. Yes. So the common program information form, as I mentioned before, it will be filled by the program director once they are starting to apply for the programs. Why we call it common? Because it reflects the common standard between all the programs. So all the common questions related, let's say, OB/GYN, psychiatry, surgery, they are included in this common program, while the specialty forms will be focusing on the specialty itself. So the common program information form, it includes general information about the application, about the sponsoring institution, about the program leadership, program vision and mission, program aims, program director, questions about him or her, associate program director as well, program coordinator, program facilities and resources, including information about the facilities and the basic data about the sponsoring department or services, especially for hospital-based services. Questions, some data about the participating sites, medical education activities, the different activities related to the programs. Faculty information, so that's a lot really. We need a lot of information about the faculty. You can see this about their background, certification, licensing, contribution, their role in the program, whether they are core faculty or faculty, and if they are physician or non-physician, and about the percentage or the number of hours they spend on the program. Resident information as well. Lots of information needed about the individual residents. Yes. Yeah, program curriculum and policies. Evaluation system. Evaluation committees. And then the appendix. The appendix include a lot of attachment, including we need the overall educational goals, the residency policies manual, the residency curriculum manual, and also the letters of accreditation from the other accreditation bodies like the Arab Board, the ACGMEI, etc. Without letters without citations, because we are not supposed to look at the citations imposed on the programs by other accreditation body. Sample of didactic program and attendance record template, CV of the program director, terms of reference and membership of the clinical competency committee, terms of reference and membership of the program evaluation committee, also list of meetings. And during the visit, we need the program director to provide on-site copy of these minutes to be reviewed by the surveyor. Also delegation letter in order to make sure that there is coverage during the leave, so there is no absence in terms of leadership. Letters of agreement with all the participating sites, and also to provide the on-site copy for the list of faculty development activities in the last year. And then we require multiple, policies related to eligibility and selection of residents, resident duty hours, education work environment, supervision, policy, evaluation policy, and also on site we require program evaluation tools. So we need the blank copy of the program specific tools to be presented to the surveyor, and also on-site copy of the program summative evaluation, which is one of the very important evaluation tool that is at the end of the education or just before the graduation of the resident. And then this needs to be signed by the program director and also co-signed by the DIO. So the next we will be presenting a sample from one program only, which was to provide you with, just for the sake of the time, we'll show you only the internal medicine program
I think we lost the sound of Dr. Moza.
Sorry, I think there was an IT issue, so I had to leave for a while. So can you hear me now?
Very clear.
Yeah, sorry for what happened. So the next form is about the internal medicine program information form. So I'll go through it very quickly. So the application, this general information about the application information, and then the table of content. And then introduction, duration of education, the institution, the participating sites, program personnel and resources, questions about the program director, the associate program director, faculty, other program personnel, resources, the institution, information about the different institution, including the sponsoring institution and the participating sites. These are the required services within the program. And then resident appointment, educational program, question about the didactic, clinical experience, the different rotations, procedures, scholarly activities, duty hours, core competences, the 6 core competences, the patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, professionalism, system-based practice. And then the appendix here, we have one appendix about the formal didactic session, the didactic curriculum, and there is a sample which will be helpful for the programs to follow this example. The next one is about the block diagram, and also there is a direction how to construct the block diagram, and there is sample to help the program director. And all of this has to be uploaded in as an attachment. So the next form will be about the internal medicine rubrics. Yeah, so this is the rubrics again. For every program, there is a specific rubrics. It's again the standards, whether met, partially met, not met, and you have to provide an evidence if it is applicable to that particular standard. And there are starting with the institution, questions about the institution, program personnel and resources, including program director, associate program director, faculty, coordinator, resources, and the resident appointment, educational program, clinical experience, scholarly activities, resident evaluation and promotion, resident promotion, clinical competency committee, program evaluation committee as part of the evaluation, duty hours, a resident supervision. And then this need to be signed by the program director as well, the DIO. So you will feel that there is some repetition between the forms, but that's okay. I mean, this will give maybe a chance to explain certain things, to check on certain things. So that is about the forms. You will find these forms in the website of the NIHS, and we will touch base on the next slide on the process. Yeah. So simply the accreditation process, if you are, an institution, you would like to apply, just you need to visit the website of the NIHS, fill the relevant application form, upload the BEF and self-assessment, submit the application, and then once it reaches the NIHS, there will be a review process through the Central Accreditation Committee. The committee will select accreditation surveyors. Those will conduct the site visit. Dr. Mariam will elaborate on this process, and then the surveyors will provide a feedback, a report to the Central Accreditation Committee. The review will be, the report will be reviewed. Recommendation, there will be a deliberation within the committee, and recommendation will be put forward, and then the certification or resolution will be issued whether the institution or the program passed the survey, and the decision will be made available for the applicant. So thank you very much, and the next will be Dr. Mariam Al-Marashda. She will be detailing more about how to conduct the site visit. Thank you very much.
Thank you very much, Dr. Amose. And it's our pleasure now to welcome Dr. Mariam. Dr. Mariam Al-Marashda, she's a thoracic surgeon at Saha facility. She's also heading our subcommittee of the NIHS surveyors. She's a deputy chair of academic affairs at Dawam Hospital. She's also a program director of Abu Dhabi Integrated General Surgery Residency Program. Dr. Mariam will be talking about how to conduct an institutional site visit. I'd like to welcome Dr. Mariam.
Thank you, Dr. Mohammed, for the warm welcoming. So my main part actually during my presentation gonna be how we're gonna conduct as a surveyor a site visit. Maybe Wafa, if you share the slides from your side. So do you hear me, Wafa? Wafa? No, I can't see it. I think Dr. Mohammed has to stop his sharing before you share. Yeah. Thank you, Wafa. Again, welcome to the second NIHS Accreditation Surveying Workshop. Next slide, Wafa. So my main topic gonna be how to conduct the survey. Next slide. Basically, in my tool or in my presentation, I'm going to touch base on how to survey the principal surveys. What are the methods of data collection? What are the sampling techniques? And I'm going to also talk about assessment tools and the surveying process. Next slide, please. Yeah. So basically, since morning, we have been hearing about the accreditation. So it's a process in which actually the quality of the training being assessed by the external body using a set of standards. So we need to remind ourselves always that the external body here, we mean by them the NIHS committee. They are the external governance for the training and for all training institutions who are going to apply for accreditation. And the internal body going to be that institution who's applying for accreditation and who is taking care of all programs underneath them. The accreditation standards, they are the basic minimum requirement, as Dr. Sheikh said earlier in his slides. Usually, they are the minimum quality or the standards for the quality of a training. It's not the sky or the highest limit, because we need to put in consideration that whoever applying to the accreditation, it's not only government hospitals, also private can apply. And not only major program or big program who have a good number of residents, and also small program can apply. So we need to make sure that all of us, we can meet the minimum requirement. And this is gonna be what's gonna be required from you as a surveyor when you go and do the site visits, to make sure that this minimum requirement is applicable or meeting our standards for the NIHS requirement. The accreditation systems, it's an evaluation system actually. Usually it's governed by the NIHS. They are the responsible actually for providing the policies, the procedures, the standards going to be available for you. It's already created by them. They're going to be heading committees, so they're going to have the surveyor committees as well, and the group who are going to be sent by the Central Accreditation Committee to that institution to do the surveys. And actually, they are the people who are the part of the accreditation who's responsible to make sure that these standards has been met, and they're going to assess these standards. So next slide. Yeah. So basically, you have been seeing the slide in the morning as well when Dr. Mohammed talked about the aim of the accreditation. It's to support the continuous improvement on residency and fellowship program according to the international standards, ensure the quality of the specialized training centers, unify the standards and the specialty training outcome. We will enhance the leadership and competitiveness in the health sector, utilize the international best practice, and enhance the local, domestic, and international partnership. Next slide, Wafa. Yeah. So there's there was a previous slide which has been discussed by Dr. Amoza regarding stages for international and program accreditation. So basically, that institution or the program, they're going to send a notification or a letter of intent to the NIHS Secretary General. They will complete both institution and program accreditation application form based on whatever they are applying. Is it institutional or it is a program accreditation? They're going to complete the accreditation form, the rubrics actually, which is belong either to the institution again or to the program, and the specialty specific standards or rubrics based on the what program gonna apply. There is a fee has to be submitted or has to be paid, and they're gonna submit all these requirements through the NIHS website. Once the application will be received, this application will be reviewed by the Central Accreditation Committee to make sure that they are all available. They're going to review it by the Central Accreditation Committee. They're going to form the group of the accreditation surveyor who are going to go for that institution or for that particular program to be accredited. So your role and why you are here actually, to know how you're going to conduct a site visit, you're going to be the people who will be sent to that institution or to that program to accreditate them. You're going to carry the site visit. At the end of your visit, going to prepare a detailed report it will be not your job actually to give them the final decision, because you're just going to create that report and you're going to take your suggestion and make sure which scale that institution or the program is meeting. And you're going to send that to the Central Accreditation Committee. Again, I'm going to repeat this. This will be the final decision will not be the surveyor group who going to go and make the decision. The report actually you're going to generate it and you're going to send it to the Central Accreditation Committee, going to be the final decision about the accreditation standard and accreditation status of that institution or the program. And by the and they're going to communicate directly from the NIHS Secretary General Office to that institution or the program to know about their status of accreditation. Next slide. Yeah. So for any accreditation process, we need accreditation system, which I elaborate earlier in my first slide of the introduction. So where's you're going to have the executive policies and guidelines, you're going to have them all different committees, you're going to have the rubrics, you're going to have the information, program information or the institutional information forms. These all, and by the bylaws actually of the accreditation gonna be there in the accreditation system. We need standards, and these standards should be available to everybody. So as Dr. Mohammed mentioned in the morning, we have an NIHS website. So this standard has been already provided in the website. You can have a look on it. This standard should not be rigid. This standard should be shared with the committee, and they have to make sure that this is applicable and applied on our community. So we have regular meetings and discussion. If there is any revision of this standard, has to be reflected on that website. So you're going to be having the updated version of these standards. For any process, we need trainee surveyors. That's why we are conducting actually this workshop today. So this is going to be a selection from the Central Accreditation Committee, and there is certain criteria which then I will elaborate later on in my next slide. So basically in the process, they're going to be a request either for a new accreditation intent, either from the institution or a program to start accreditation in that institution or the program. And once they got the accreditation being issued, we need to make sure that there is a maintenance of this accreditation. So there might be down the road, once they're going to be a timeline where we need to re-accredit them. So they're going to be another request sent by that institution and the program to make sure that they are maintaining. So again, the Central Accreditation Committee going to send a surveyor group again, just to make sure that these centers or institution and programs are maintaining their accreditation and their standards are still in the good quality. We're gonna have, there is an application assessment. We're gonna conduct the survey. There is a self-assessment form need to be filled by the institution and by the program if they are applying for the accreditation. And once the surveyor group being selected, you're going to go for that survey for the site visit. So you're going to do the on-site survey on arrival to that institution, either for the institutional accreditation or the program accreditation. The outcome of your visit going to be the report, which you're going to generate it based on whatever requirement they are meeting in all the domains of the survey or the rubrics we're going to be provided for you. The report going to be submitted within and the same day at the end of the visit. Usually the surveyor team, they sit down together, they put their suggestions, they put their ideas, and they generate the form at the end of the visit. By end of the visit, once the report being submitted, you cannot communicate with that institution with any other means of emails, WhatsApp calls. Once you already generated that report, that's it. And you cannot take any paper after the site visit. If there is any missing document has been requested, maybe during the site visit, not provided, you cannot take any document with you outside that facility, because it's belong to that facility and gonna breach, it might breach any confidentiality of that institution or their resident or trainee or their faculty. So you're gonna submit that report to the Central Accreditation Committee, and they're gonna review that your decision and your feedback actually. Based on that, they're gonna make a decision regarding the accreditation, and they're gonna communicate and they're gonna issue the accreditation certificate. The date actually, the Central Accreditation Committee, the NIHS Secretary General gonna send a notification to that institution regarding the status of the accreditation, gonna be that date, start of their accreditation cycle. As I mentioned, this center has been applied first time for the accreditation. They need to maintain accreditation. So they're going to be a notification from the NIHS Central Committee regarding the next cycle of maintaining their accreditation. And they're going to be a schedule for a re-accreditation survey or visit. Next slide. So this is, you saw this earlier with Dr. Moza. So application has to be initiated through the NIHS website. Again, everything is available in the website. You can see later on, we're gonna go through the website again. They need to fill the form, upload the PIF as she said, submit the application, review. Application will be reviewed by NIHS Central Accreditation. They can create the Accreditation Surveyor Committee, or the members who are gonna go for that survey, and you're gonna go to do a conduct or to do the site visit for that institution. And you're gonna prepare the report, which you're gonna submit it finally to the Central Accreditation Committee, and they're gonna take the decision in terms of issuing that certificate. Next slide. So again, the process, this is again the same process, initiation, just to know where you are as a surveyor gonna fit in this process. You're gonna be in the NIHS after the NIHS decide which group gonna be selected to that particular program or institution, and you're gonna be inspecting that institution and you're gonna conduct the survey. Next slide, please. So what are the criteria for you to be a good surveyor, or a minimum requirement for any surveyor? All these requirements, you're going to find it later on in the NIHS website again. So for any surveyor who want to apply to be in the accreditation surveyor team member, you need to be a consultant in one of your health specialty or have equivalent qualification. You need to complete an NIHS assessment courses. There are certain courses you need to complete it. You need to obtain a specialized training, at least 3 years of experience in your specialty or in that training. You need to have a professional experience in medical education. Maybe you have been a faculty or a core faculty in that a program. Maybe you have been a member in the graduate medical education committee. So we need an proof that you have an experience with medical education and medical education background. You need to implement NIHS accreditation policies, system, and procedure. This is going to be provided actually by the NIHS groups. You need to make sure that you're going to free yourself at least 5 days per year to conduct the site visit. It's an early agreement, and you need to sign on that an agreement that you're going to free yourself. So you send a notification to your chair of department, or you take it from your annual leave. This is going to be decided later on once, and I think it's manageable. It's only 5 days in the whole year that you need to free yourself to conduct the site visits. You need to sign a conflict of interest declaration form and protect the confidentiality of the data and documents you're going to be provided by NIHS of that or the institution when you go to do the site visit. You're going to provide a reference of recommendation letter from your DIO or the training manager that you really meeting the standards to be a member of accreditation. You're going to provide evidence for a prior professional development. Maybe you attended already any assessment workshop, any faculty development, and how to inspect, how to do internal review, how to do an institutional visits. So if you have any evidence of this, you can provide us with this. Continuous professional development and assessment and accreditation field to maintain the NIHS membership. Not only attending a workshop and that's it, but we want to make sure that you are keep developing yourself yourself in terms of assessment tools and meeting a requirement and know what's updated in the NIHS website in terms of their regulation and rules and policies and procedures as well. Next slide, Wafa. So here actually a sample or this website show us that there is a website nhs.uaeu.ac.ae. When you click on this, actually it will take to the accreditation part in the banner. Then you're gonna have the NIHS Accreditation Surveyor team. You're gonna have all the rules and responsibility of the surveyors available for you. There is a brochure and there is a booklet as well, which can show you actually what's your rules, what is required from you. There is a registration form. You're gonna find it in the e-service part where you click, and there is a registration form for the surveyors where you need to upload your CV, you need to upload the experience letter. If there is any, maybe there is a personal photo, you need to sign the declaration form and submit this to the NIHS within a certain period of requirement. Once the accreditation has announced actually that there is a surveyor, they calling for surveyor, and there is a certain period you have to do it and submit your application. Yes, Wafa, next. So once the Central Accreditation Committee decided who's going to be the group or the team who's going to go and inspect that institution, usually it's an average of 2 to 3 members, has to be from outside facility. If you have any disclosure, you have to notify the NIHS earlier, at the time when you're going to meet with the NIHS, actually at the time of taking decision who's going to go and inspect. Suppose you have been working in that institution in all days, you need to disclose this to the NIHS and you need to notify them. Maybe you are planning actually to apply for a position in that institution. So this has to be disclosed actually to the NIHS committee so they can take a decision. Do you fit actually to visit that institution, or this might affect our decision or your inspection decision as well? So we need to disclose, any disclosure has to be mentioned and notified to the NIHS committee. At least one of the member has to be a subject matter expert, especially for the people who's doing subspecialty who are going to do a specialty visits for any programs. Suppose the OB-GYN, one of the surveyors has to be an OB-GYN consultant who gonna go, so he knows actually what are the requirement for this specialty. Your main function as a surveyor, as since morning we have been mentioning, to validate if the accreditation standard has been either met, partially met, or not met, or maybe it's not applicable. If there is actually a new program, if there are certain standards they did not have it, maybe they're gonna have it in the future as a recommendation. So this is gonna be your job to validate that these standards are available and these institution or program who's applying for accreditation are meeting these standards. It is not your decision to make which center or which program gonna be receiving the accreditation. You're just gonna conduct the visit, you're gonna generate a report and send it to the Central Accreditation Committee to take final decision in terms of accreditation issue. Next. Again, roles, this has been seen already in the morning. You're going to be operationalize the accreditation system and standard. Our role as a surveyor to improve the quality of program delivery, to strengthen the capacity of the institutions and program, support feedback and reflective practice, and disseminate knowledge and expertise in surveying institution and a program. And it is a continuous process actually. That's why once you have been selected as a surveyor, we want to make sure that you are maintaining the standards and you are keep updating yourself through the provided workshop from the NIHS. Next. So what we need to remind ourselves, what's the function of accreditation? Is it only to assure the quality or also striving for excellence? So actually, the function of accreditation are both assurance of the quality. We want to make sure that this program and institution who's applying for accreditation, they are maintaining the quality this year, similar or good as it was in last year. So they are maintaining their quality of the training. And also it's going to be a tool for striving for excellence. So it will give a chance actually for that. And there is a chance for either a program or an institution to give them an opportunity actually to strive for excellence. And this opportunity has to be recognized. So we know that these programs and institutions trying their hard to maintain their accreditation, and they are in continuous improvement during their presence or during their accreditation process. Next, so we need to make sure that there is a balance in the training actually culture, not only concentrate on the medical aspect and experience, so not because basically our the traditional when we are in any training program, we concentrate on how our trainees behaving and their medical knowledge and the clinical skills. But there is other competency which should be in balance with this medical and knowledge and medical and clinical training, which has been discussed in detail in the form of Dr. Moza Al-Subusi in terms of their environment, the policies, in terms of the support system provided from the governance institution. All these competencies should be in balance with the medical training, just to make sure that we are assuring the good function of the accreditation quality and strive for the excellence. Next slide, please. So as a surveyor, when you're gonna go and inspect any institution to get the accreditation, these 5 main domains gonna be repeated on both institutional rubrics and also in the program rubrics. You're gonna talk or you're gonna inspect about the governance, either the DIO who's applying actually for that institutional accreditation, or the program director who's applying for the program accreditation. The training environment, there is details component and the standards and the requirement in terms of the training environment, and it has to be meeting the minimum requirement. You're gonna have a meeting with the trainee, the resident and the fellow in that institution. In both program and institutional visit, these are the mandatory component need to be inspected by the surveyors. The other group gonna be the faculty, who are members either from the in the program, and also members, some of them members in the graduate medical educational committee. So these are important personnel you need to meet during your visit, and you need to make sure that you're gonna touch base during your visit on the quality projects and the new innovation and the innovation actually and the continuous improvement of that component and the quality projects of either institution or program accreditation part. So these are the basic 5 domains which you're gonna highlight during your visit. And other slides you're gonna see actually in details where we're gonna talk about each component separately. Next, please. So there is basic pillars about accreditation standards. Accreditation standard has to be publicized. That means it has to be available for public. We have the NIHS website. You can go through it. You can see that there is all bylaws, policies, procedures available. So it has to be accessed actually by the members who is applying actually for accreditation, or whoever institution or program is interested to apply for the accreditation. So they know what are the guidelines, what are procedures, what are information, what are the forms needed to be submitted either for the accreditation of the institution or the program. It has to be in a broad input. As I mentioned, not only government hospital gonna apply for accreditation, also small hospital might apply who contain 2 to 3 residents, but still we have to address all healthcare sectors, big program, medium program, small programs, government and health and private sectors as well has to be involved in accreditation to make sure that we are in training, the standards are equal on all healthcare aspects. These standards should not be prescriptive. Let me give you an example of this. Like when you have the standards written, actually, suppose we're gonna talk about requirement of a program of having a secretary or having coordination. So the requirement when it will be written in the standards gonna be the minimum requirement. The requirement which is gonna be stated actually in the standard, you're gonna see it in the booklet, either the manual of the program director or the institution. It will be adequate secretary provided. So you are as a surveyor, when you go to the site visit, you meet the program director or the DIO, you're gonna ask them, do you have enough support or adequate secretary coverage for your program requirement? Suppose that a program consists of 200 to 300 residents. So for them, it might be, they might assign 3 secretary. So that program director is gonna tell you, well, yes, it is adequate for our program. Maybe in other institutions, they have small programs who consist of each program consists of 2 to 3 residents, and they get assign only 1 coordinator. But when you meet the all program director, you're gonna ask them the same question: do you have adequate secretary support? All of them gonna say yes, because yes, she is covering 3 programs, suppose ENT, surgery, and OB/GYN, but that secretary support is enough for them. So this is what I mean by non-prescriptive. This standard has to be developed by consensus. So suppose like we have Dr. Muhammad, Dr. Moza, and Dr. Aisha, they cannot create the standard and keep it rigid for themselves. They have to share it with the committee. That's why we created scientific committees on all specialties where we can share our ideas and we do consensus to have best actually outcome from these standards.
You lost your sounds.
Yes, Victor? Do you hear me?
We cannot hear you.
Anybody else hearing me?
Yes, now we hear you.
Yeah. So this consensus has to be shared with your committees. Whenever there is an update, it has to be applied actually to our community as well. Standards should be dynamic, should not be rigid. So whenever there is an update or there is a modification in the standard, you're gonna be modifying it and you're gonna be make it available actually to the audience or the people who gonna apply for accreditation on your website. They should be dynamic and should not be rigid. The standard should not be ambiguous. That means you should not have 2 persons who have 2 different ideas on how to interpret these standards. So they have to be written in a clear language, easy to be understood by all members and for the people, and should be easy for them to apply as well. It should reflect societal value. We might adopt standards which are international standards, as we did actually in most of our program stuff. We adopt some standards from ACGME, but we made sure that this is applicable to our community and we can apply it during our training to our community. So it has to be reflecting your societal values. There should be a variable weights for the accreditation standard. Not all of them should be the same weight. As I mentioned, there is different competencies, there is different requirement. So you need to highlight a certain weight for each standards and make sure that that institution or the program who's applying know the different weight of these standards and to make they are compliant and meeting the minimum requirement of these standards. Next, please. So as Dr. Moses said earlier, the institution has to do the pre-survey self-assessment. That institution has to complete the standards, the information form, the rubrics required for them to apply for accreditation. They're gonna, actually it's very healthy exercise for that institution. While they are doing meticulous actually filling of these forms, they might realize how is actually their training is running. Maybe they are missing something, maybe they need an area of an improvement in certain standards. So it's a healthy exercise for that institution. And they need, once they fill the forms, actually, it has to be signed either by them, it has to be signed by the DIO and sent to the NIHS accreditation team who are gonna receive the survey and make it available for you as a surveyor. All forms gonna be shared for you prior to the visit. So you have a time to read these rubrics, to read all the information. You're gonna have an idea about the institution, or the personnel who's working there. You're gonna have a CV of that DIO, or maybe the program director, the APD, the roster of the faculty if they are applying for the program accreditation. You're gonna have a roster of residents, so you know how many residents in that institution. They're gonna give you an overview. Actually, when they fill the rubrics and the requirement form, you're gonna have an idea about the environment of that institution and that program. The curriculum actually handbook, you're gonna receive it earlier, actually before your site visit. So you have a time to arrange your timing when you conduct your site visit on that day, on the day you are doing the survey. And as I said, that form, all these forms has to be signed either by the DIO if they are applying for the institutional accreditation, or the program director who's applying for the program accreditation. Next slide. The output from your visit, I've been keep emphasizing in the morning, your job by end of that survey, you're gonna generate a report. You will not do it individual as a surveyor member. You're gonna sit with your surveyor team at the end of that meeting and at the end of your site visit before the debriefing with the DIO or the PD. You're gonna generate the cross-sectional assessment actually based on the rubrics available, based on the document has been provided for you in the site visit. Suppose maybe in the morning you have been requested for certain policy. This policy was not available in the morning. You make sure that maybe you have a time during afternoon or before ending the meeting that you have been reviewed that policy. Otherwise, you need to mention and record in your report that this policy has been requested in the morning, but still it's not available. Suppose as well, maybe there is a certain policy in terms of training, duty hours, or their contract, which has been missing signing from a higher authority, either the CMO or the CFO actually of that institution. Make sure that they don't underestimate the training policies and they treat it equal to their institution policies as well. So as the aim of accreditation surveyor, your job gonna be generating the report, and you're gonna submit that report to the NIHS Central Accreditation Committee member to take a decision regarding if they are meeting the requirement after they're reviewing it, and they're gonna issue actually the accreditation status of that institution or the program. Next. Yeah. So as a surveyor, when you go actually to do a survey, these are stuff you need to be familiarized yourself prior to the visit. The NIHS documents plus the sponsoring institutional documents. The documents of the NIHS, it's available in the website. You need to be aware about the bylaws, about the regulation, the procedures. You need to know about the forms of the NIHS institution and program accreditation requirements. You need to be aware and familiarize yourself about if there is any, and a previous NIHS survey report has been generated, if if that program has been accredited earlier. If there is any decision made, if there is any citation provided for that program or that institution during the accreditation. Familiarize yourself with this information. It's gonna help you actually to manage your time and save time for you so you can address the whole aspects of the standards required for you to review during the site visit. And also the application forms and rubrics, since you're gonna have this information ahead of time, so you can avoid repeating the same forms or asking the same stuff which already you have an information about it earlier. Also be familiar with the sponsoring institutional document which is going to be shared with you. Suppose the sponsoring institutional policy and procedure which is going to be sent to you, the supervision of training, the appeal, the harassment process, or the policy, the duty hour policy, and etc. So familiarize yourself with all information has been provided you by the NIHS prior to your visit. If that institution is applying for accreditation, make sure that you be aware about the minutes and the terms of reference and membership of the graduate medical education. And if the program is applying, we need to make sure about to be familiar with the minutes, the term of reference and membership of the clinical competency committee meeting and the program evaluation committee meeting as well. It's very, very important to know these components because it's a part from the rubrics where you're going to inspect that institution or that program when you are doing the accreditation surveying visit. You need to know about the program letter of agreement, how it's designed. The template is available, gonna be shared with you, so you're gonna know who's gonna sign this agreement template, and you need to make sure where is the signature of the DIO or the program director on that template, and what is written exactly regarding the role of that institution or that program faculty who's involved in education. You're gonna know or familiarize yourself about the evaluation tools. There's going to be a different evaluation tools going to be provided. They're going to provide you with the samples, so you should know about the process, how it's done. And the training program, either curriculum or the manual, going to be provided for you. So it's good that you go through it, so you know what they are missing in terms of competency during the assessment. Next, Wafa. Yeah. This is a general guideline for you as a surveyor to be aware when you are conducting a site visit to either institutional accreditation or the program accreditation. You need, as a surveyor, to set the tone of the meeting. You're gonna receive you're gonna receive the agenda of the institution accreditation survey and the agenda of the program accreditation survey if they are applying for the accreditation for the program. So it will be your job as a surveyor to set the tone of the meeting. You're gonna decide that how you're gonna follow or conduct that meeting. As a surveyor, you should be aware that you are here when you are doing the institutional visit, you are representing the NIHS. You are not representing yourself, not your specialty, not your degree, or the health sector you are working with. You're gonna represent only NIHS. You don't need to disclose to them that, or you don't need to mention what is your specialty. You just introduce yourself. Well, I am Dr. Iman or Dr. Selwa. I'm here actually as a surveyor from the NIHS, and I came to make sure that your institution or the program is meeting requirement based on the rubrics which we're gonna be inspect during the visit. So you represent the NIHS. Very, very important to know about this. When you're gonna conduct your site visit, make sure we are peers. So we are doing that, we are not policing them. So we need to do this in a collegial and humble way and very kind way. So it will be easy for that institution or the program to give you information. When they're gonna see how kind you are with them, how flexible you are with them, they're gonna be happy and providing feedbacks and providing suggestion. They will try not to hide information from you. So try to be or conduct your visit in a collegial way. There is survey etiquette you should be aware of, some habits. If the NIHS have provided you with the ID, make sure that you wear your ID all the time during the visit. If there is a pen provided, you can wear that pen. The way you communicate, very important. It has to be done in a very professional way. Just a reminder again, we are representing NIHS, so we have to be very professional during conducting our visit. As I mentioned earlier, we need to waive if there is any conflict of interest. In the previous slide, I told you, if you are applying a job for that institution you are going to visit, you need to disclose it to the NIHS. Maybe they won't change their mind and then not send you to do the site visit, and maybe they're gonna change. They inform, or maybe they select somebody else instead of you. Always start the meeting when you meet with the personnel, either the DIO, the program director, the faculty, the trainers, or the resident and fellows. Always start by introducing or inquiring about what are the areas of strength in the program. It's a good start actually during the interview with the personnel. What are the areas of improvement? If there is any concerns you want to mention, it's good to start actually your meeting inquiring about these areas. Always when you meet people, inform them why you are here, introduce yourself always during the meeting, and inform them what's your role and what they are expecting from you during the meeting. Why you are here today in the morning. So whatever group you're gonna meet, repeat, introduce yourself, and re-emphasize about your role as a surveyor. We are here just to check how your institution or your program is meeting requirement, the standard requirement. We are not here to police. We're just gonna convey this message to the NIHS so they can know how the program is running and how your institution training environment is. Next slide. Also be aware about any suggestion of or prescription. As a surveyor, you are not allowed to do any consultation for them. You are not allowed to give any suggestion for them for improvement, because this is a job of the institution or the DIO or the program director to make sure that they are compliant with the requirement of the NIHS standards, and they have to find a solution. It's not your job as a surveyor. You are just there to inspect and see what's going on in that institution and if they are meeting requirement. You are not there to give any feedback or suggestion and counseling for them if there is any issue or there is any problem needed to be sorted out during that visit. Try to, during your interview, to make sure when you give them questions, to be open-ended questions whenever it's possible. Avoid to say why, to start your question with why, how, when. It's better to be an open-ended question. What do you think this could be happening? Also, confidentiality of the training center. They provide you with all this information because you are representing the NIHS. If you are not a part of the NIHS surveyor group, you will never receive this information. You are not allowed to take any information outside and disclose it outside your visit. Once the visit is happened and ended, actually on that day of the agenda provided, your job is done. You don't do any communication with them, you don't disclose any information, and you don't take any papers with you during after the visits. The survey team, since you are consist of 2 to 3 surveyor, actually the work has to be dynamic, so you need to set a plan earlier, which question you're gonna ask. You're gonna assign your colleague to a certain part of the standards. You're gonna inspect either the governance. I'm gonna inspect the faculty part. I'm gonna inspect during the event. The document viewing has to be divided, so it has to be dynamic and to save time for you during the visit. Try to stick to the schedule. You have the agenda, you have the timing, you can, if you finished already your part during a certain agenda period, do not try to stretch the time. You can utilize this time for the institutional review or the institutional overlooking actually at the end of your or during your visit. As I mentioned, you can't give them any counseling. You can't give them any promises. Your job is just to convey the messages to the NIHS Secretary General and the Central Accreditation Committee. And this is going to be a job of them to deliver whatever needed from them to improve in future. The survey, when you are doing the site visit, it's a snapshot of that time. You don't, so it has to reflect what is happening in training now. We don't want to hear what has been happening 3 years ago, but it's not available in the documents, or it's not proven in the documents that it's happening now. Suppose the schedule, they have a certain schedule of the rotations 3 years ago, and they are providing the old one, but in reality, when you sit with the resident and discuss a rotation, you'll find out it's not the real actually rotation what they are doing. So it has to reflect the current status of that training to make sure that we are following the quality which is happening now, not anything in future or anything in the past. And you should have a power of listening. Do not interrupt a resident while you are talking, while they are talking. Faculty, if they are giving ideas, do not interrupt them. Listen to them till the end, and maybe at the end of your conversation you can add your suggestion, you can clarify, or you want to add anything, you can mention it. So we need, as a surveyor, to have a power of listening. Next. So now, in terms of the institutional preparation for the site visit, so that institution applied for accreditation, or the program applied for accreditation, what is required from them? They have to provide you, as a surveyor, when you go for the site visit, they have to provide you with a suitable room or an office to do your work and the interviews. The DIO has to be available for the accreditation surveyor all the time and duration of the site visit. He cannot leave you in the middle and say, well, I have a commitment or I have a meeting. He has to be available during the site visit the whole time till the end of the site visit. You should have an immediate access to any relevant building. You should not wait for a permission, because this has to be sorted by DIO or the program earlier, since the agenda has been already shared earlier with them to prepare themselves. They have to prepare all the required document and the information requested by the NIHS. So this is their job. They have to make sure that these documents are available. We don't like to hear that, well, I'm not expecting that you're gonna ask, because there's certain requirement and information has been sent to them, need to be available during the time of the site visit. They should notify those involved in the interview. They have to make sure that their faculty, resident, the institution be aware that we're going to conduct a visit and doing a tour during the site visit. So notification should be sent to these people earlier. Next slide. So these are the agenda of the institutional accreditation surveyor. You're going to receive it as a surveyor team earlier. So make sure that you be aware. For the institution accreditation surveyor agenda, go back here, Wafa. So in the morning, you're gonna meet with the DIO and the institution coordinator. You're gonna sit down with them, and they're gonna give you a brief information. You're gonna review with them the document has been sent and the self-assessment form, which has been sent earlier to the NIHS group, and you're gonna be reviewing it earlier before your site visits. So you're gonna spend this time just to make sure that it is really what's happening. And make sure that whatever document has been provided, it's happening in reality and meeting a requirement. So they're gonna give you the overview in the morning with the DIO. Once you finish from the DIO, they're gonna be a part of document reviewing. As I mentioned earlier, some document gonna be shared with you as a surveyor earlier before the site visit. Familiarize yourself with these documents. Beside that, there gonna be some appendix will be required from that institution to provide. Maybe you want to see the new innovation system. You want to make sure, you want to see the minutes of the GMAC, maybe. You want to see the members. You want to see the minutes for the last 2 years of this graduate medical education. You want to see a certain policy toward that institution, the program letter of agreement, the whole information. Dr. Amoza went through the in the rubrics. Actually, some of them will be required to be reviewed, and you need to make sure that you work in a dynamic way with your surveyor group to make sure that you are reviewing, you make sure to review all required documents from you, because at the end, again, you're gonna generate a report. So you need to make sure that you have an evidence stating why this institution is meeting requirement. And the review gonna be with the DIO and institutional coordinator. So they can give you an access, and they're gonna show you which document is required from you to be inspected. Then you're gonna meet the graduate medical education members, including the program director or any representative on their behalf, like APDs. You're gonna, the internship representative if available, the quality department, if they are part from the graduate medical education if available. Sometimes CMO is a part of the graduate, they are a part of graduate medical education. So if they are available, they are welcome to be reviewed or will be interviewed during the graduate medical members meeting. After that, you're gonna meet with the residents, the trainee, very important. You're gonna meet the representative from all program and the levels. From R1 to R4, the program are 4 years duration or 5 in some surgical specialties. So you're gonna meet the representative from all programs and all levels as well. You're gonna have a break, and that break, there should be a light lunch. Utilize the break. Don't underestimate the break, because the visit, whoever conducted the visit earlier knows how detailed is the visit. It required an energy from you to spend, to be aware and to be alert and to be awake actually till the end of the meeting, so you can sit down and prepare your report and make sure that you review everything. So don't underestimate your break. The institution provide you with the lunch, it's fine. Otherwise, you have to find your way and getting lunch and regain your energy before you continue your site visit agenda or the meeting agenda. Facility tour. Whatever is the quality of that institution, even if it's the best program or best institution in the world, you should do the facility tour to inspect the on-call rooms, the lounge, the training classrooms, the OPD. You need to have a look on them. You're gonna have a tour in the ward, the ER, the OR, the lab, radiology, and pharmacy department. You cannot end your survey visit without having a facility tour. Either it's the best program in the world, as I mentioned, very, very important, because there is certain aspect which you need to document at the end of your survey report in terms of the facilities available. And this is very, very important to support actually the quality of that institution in terms of meeting requirement and certain domains or certain aspect of the standards. Then you're gonna meet with the sponsoring institution medical director and the CEO if available. Very important, so you can ask about how is the support of that institution medical director or the CEO to the institute, to the DIO and their faculty and their training programs, which is under the umbrella of this training institution. Then you're gonna do the survey close meeting. It's going to consist a meeting for the surveyors, the group of the surveyor who conducted the visit since the morning. They're going to sit down again, and they're going to sit down and make sure that they check on the requirement which they have been interviewing since morning or reviewing document in the morning, and they need to put in the scale of meeting requirement, not meeting requirement, or maybe partially meeting requirement. And you need to document on that report what were the evidence if there is no meeting a requirement or not applicable. Maybe a new institution applying for accreditation. So it's maybe they don't have any reports or internal reviews or citations before, so it's not applicable because it's the first time that they are applying for this accreditation. So your job is to prepare the survey at the end of your visit. And again, it's not your decision. It will not be your role actually to make a final decision in terms of accreditation. And in the debriefing, exit debriefing meeting with the DIO, you're just gonna thank them that they provided you with this space and they provided you with the time since morning to meet all this personnel and give you an access to their facility tour. And again, you're going to emphasize, well, we already went through the requirement or the standards, and we're gonna prepare our report, and we're gonna submit it to the Central Accreditation Committee member, where who gonna actually communicate directly with you regarding the final status of your decision of accreditation, and it will be directly through them, not from us. Once the visit is ended, you are not allowed to do any kind of communication, not allowed to take any paper with you, just to make sure. Suppose during the meeting, when you are meeting the residents, like doing a resident meeting, so you ask them a question, if there is any like harassment incident or stuff. Nobody mentioned this, but by the end of the meeting from the resident, one resident came to you in a private and he wanted to mention this. Well, I have an issue and I was not comfortable in the morning to mention this. In this situation, you cannot do the meeting alone. You have to gather your colleagues. You have to sit down with your colleagues and you have to mention this in the report as well. Well, in the morning, we had a meeting with the resident. We addressed the harassment issues. There was no harassment documented or being mentioned by the resident. But toward the end of the meeting, we met such a resident who mentioned this, because we just want to make sure maybe you are just hearing one side of the story. So just document this for them, and it will be actually NIHS committee rule, or it will be their job actually to finalize or to find out from the DIO what's going on. Okay. So by end of the exit meeting with the DIO, by this you're gonna finish your agenda for the institutional accreditation. Next, Wafa. The difference between the program accreditation visit and the institution accreditation visit, the person who you're gonna meet in the morning, you're gonna meet the program director with their coordinator and the associate director available. You're gonna do the same. You're gonna document. You're gonna review document not related to that institution, but related to that specific program with the program director and coordinator. You're gonna meet resident who are representing that program, not all program, but only particular to that program in all levels, from R1 to R5 and R1 to R4, whatever the program duration is. You're going to meet with the faculty. Minimum of 5 is a requirement, but the program is big and they have more faculty available. So you can meet them all. Just put in consideration the place actually when we provided to meet these people. You're going to meet the head of the department when you do the meeting for the program accreditation, just to find out how they support the program director, how they support the faculty, how they reward them, what's their role in engagement of training. Again, the break, very important. I went through the survey, so visit, so I know how important it is to have a break so you can regain your energy and to be aware that you can continue or complete your visit with full energy. Again, facility tour. And the facility tour, this is going to be related to that program, the on-call rooms, the lounge, the training classroom, the OPD for that specialty, the wards they are utilizing, ER section, maybe if they are doing some rotation there, and OR if any surgical specialty has been inspected or has been applying for accreditation. During the facility tour, if you see a resident belong to that program, you can ask them questions because maybe they were not available because they were busy in the morning or maybe in the theater or they are on call at that day. So utilize this opportunity to talk to the resident. Just a general question, but don't ask them to step out of their operation theater room or from their clinic while they are doing interview with their patients. But if you see a resident who's free around or a faculty from that specialty around, you can take that opportunity to ask how happy they are from the program and a certain question just to address the standard you're gonna require during your visit. You're gonna meet with the DIO in the afternoon, and after meeting the DIO, you're gonna do the closing survey. Again, you're gonna prepare the report and make sure you don't take any information and don't disclose anything after the meeting. And again, you're gonna generate a report which will be submitted to the Central Accreditation Committee to make a decision about the accreditation of that program. And you're gonna do the exit debriefing with the program director, thanking them for providing the time, arranging the facility, make sure that and that they provided you with the time with their resident and faculty, and made giving you a chance to review their documents. So this is a difference between the institution and the program accreditation survey agenda. Next, just to let you know, maybe if you want to later on in the Q&A actually panel, we're gonna have a separate session. So if you have any question later on, you can either you put it in the Q&A button, or maybe you can wait till end of the my presentation, or Dr. Mohammed Al-Huqani executive the end of presentation to answer questions. So for any program to apply for the accreditation, it might be a new accreditation, or maybe that program want to maintain the accreditation. Maybe that program had a conditional accreditation follow-up visit, so this could be another reason for surveying that program. There is any warning for a freezing follow-up visit, or could be a freezing follow-up visit for that program. Maybe that program withdraw, so you want to make sure what's happening actually in that institution. And maintenance of accreditation random survey. So if you have been provided as a program for accreditation, suppose for 5 years, maybe later the NIH is going to decide randomly they're going to visit that certain program just to make sure that they are maintaining their quality of a training and maintaining the standards, minimum standard required from them. And maybe there were citation and red flag initiate, this could initiate the survey site visits. Next. Again, goal of accreditation survey to validate if the standards are met. This is your job as a surveyor to make sure that these standards are met or not met maybe. So based on that, you're going to generate your report and make sure that there is a quality assurance and improvement of the quality of the training in any program or institution. Next, please. This certain stuff you should avoid while you are doing your interview or you're doing your site visit. Avoid starting your questions, as I mentioned, with why, how, and why, and it's better to be an open-ended questions. And maybe you can preferably to you, can you clarify why you have only 3 residents maybe in this rotation, or you have such a faculty here? So it's better and preferable to use these phrases. Try to fill the time. If you are done with your component, do not try to stretch the interview. If you are done, utilize that time in doing your review, because document review sometimes takes a bit longer time based on that institution or the number of residents available on that program. Do not fish or grill as an etiquette or as a habit of you are representing NIHS, so it has to be done in very humble, kind, and in a very professional way. Do not fish or grill, because this gonna be you're gonna be again representing the NIHS. You are not representing yourself, so avoid this. And it's not your job, as I mentioned earlier, to do any consultation, give a solution, because it's a job of the institution to maintain accreditation and the standard, also the program job. Next, please. Let's come to the document review. Do you want a break of a few minutes, then continue or you are fine that I continue with the slides?
Dr. Mariam, I suggest to continue. You're almost done. I can see that.
I'm almost there. A few slides only left. So in terms of document reviewing, as I mentioned, and you're going to receive the pre-survey assessment form earlier. You're going to receive some documents earlier. So it's better that as a surveyor, you review these documents. So it will help you to organize your meetings. Look at the document, looking to them earlier. Actually, this can initiate some certain questions at various meetings with the people. Document to be reviewed, very important that you review minutes of the GMAC, as I mentioned earlier, CCC, Program Evaluation Committee meeting for the last 2 years if it's available. The curriculum, the goals and objectives, the program or goals and objectives of their institution. You need to review the examples of selected educational schedule and content, training assessment file and logbook. Sometimes you might need just to see if for the institution, you need to see the process. If they have a logbook, if they have assessment tools, you need to review them without having names. You might have only like a document sample for that. Example of the trainee, of the faculty and resident files and their job description. Assign, as I mentioned, divide the document between you, because as a surveyor, it's a lot of document to be reviewed beside whatever you have been reviewed before the visit. So try to set a certain document for each other so you can utilize your time and do it in a dynamic way, and review whatever DIO, program director, and the resident professional registration forms and classifications as well. So this is a part of document review. Next. Very important when you go actually for document reviewing, you need to know about the minutes of the graduate medical education and the program meetings, which I mean the clinical competency meeting and the program evaluation meeting. You need to review actually who's participating in the graduate medical education, if there is any elected resident or fellows, and if there is any elected faculty representative, how they are doing the election actually, and who are the members of this committee. The agenda, if there is any resident evaluation discussed already, if there is issue has been discussed, you need to see them and review them. Any action plan taken, any follow-up, any remediation process, then you need to see samples of them. If there is any internal review has been discussed earlier, any action plan has been implemented or not. It's very, very go thorough reviewing of these documents. You need to know that they should meet quarterly. Minimum is quarterly, but they can meet more than this. But this is the minimum requirement for this. Next. In terms of reviewing the curriculum, make sure that you see the schedule of the academic activity for that year. It should be made available for the surveyor, and you can actually make sure that this is the real curriculum when you are interviewing the resident. The specialty specific resources and indicated in the curriculum should be available as well, made available for and utilized in the training program. Both faculty and residents who's participating in the program academic activities, you need to monitor and see how they are monitoring the attendance actually of their faculty and the attendance of their resident to their academic activities. Very important to review this, and you know what's the process and how they are handling that monitoring process. Also evaluation tools and evaluation methods made for the residents and also for the faculty. There's goals and objectives of that curriculum. You need to see if that they are following the competency requirement for these goals and objectives in terms of their rotations, in terms of their academic stuff. Next. Again, the curriculum used in the training as per NIHS requirement, you need to make sure that it's meeting requirement of the NIHS and following the competencies required from the NIHS. Both program director, faculty, and resident should have a copy. You need to make sure during the interview that the resident and the faculty receive a copy of these curriculum. So this is going to be a question generated by you as a surveyor. Do you receive a copy? Do you have a copy of your curriculum stating what's going on? Actually, you have the goals and objectives of your training or your program. When do you receive it? Do you receive it at the beginning of each rotation? And how they make sure that you already received it? NIHS competency framework is clearly evident in all aspects of training, delivery, and assessment, and a clinical rotation and a master rotation. As Dr. Moza mentioned, there is a form, an example how to do the master rotation. You need to make sure that it is compliant actually with the NIHS requirement, and it should be available for you as a surveyor to view it and make sure that it's happening in reality, because it could happen that they are not giving you the correct one or the updated one. Make sure that it's happening with the reality when you are asking the resident in terms of their rotations. Next. So in terms of resident and fellow assessment, it is a crucial part during the document review that you see if there is any assessment process done for this resident. Not certainly they have to mention if they can hide the names, but at least you need to see that there is an assessment process is happening in that program to make sure that they are maintaining the quality of the training and the promotion and assessment of their competencies of this resident. Review any appeal process if it's available and provided to you. You need to review and you need to see what was the action plan written and how is the follow-up of that appeal process. Very, very important. It's one of the standard required from you as a surveyor to review it. Look to the assessment form. Maybe there is some program specific form needed. There is rotation specific evaluation tool form. Actually, there is a resident to faculty evaluation, faculty to resident evaluation, maybe resident evaluation from patients, from nurses. You need to review these. If you ask them, they need to provide you with this information, and you need to inspect or you need to review these forms. You need to check if it has been completed in a timely manner. If it has been, the evaluation has been signed by the faculty who's training that resident and fellow. And you need to make sure that if there is any violation for this resident need to be provided. And if there is no violation, at least what's the system to track actually violation in their duty hours. And if they are following the minimum requirement of the duty hour based on the NIHS requirement. Next. So survey meeting, as I mentioned, and the institutional site visit, you're gonna meet with the DIO initially. You need to know how does the graduate medical education function. It's gonna be questions you're gonna ask for the DIO. What's the role of the program director in the graduate medical education? What's the role of the resident and fellow if they are participating? Because there should be an elected people from fellows and resident within the graduate medical education committee. You need to make sure that they are available, and there is the minutes documenting about availability of these people during the meeting. Clarify the forms of the graduate medical education minutes document. You need to know how frequent they are doing it, how's the training running within the institution, what are the resources and the support adequate actually from the institution given for the DIO. How is the training program structured and delivered? This is going to be your question to the DIO as well in the morning. How's the communication way between the graduate medical education? The minutes of the agenda being shared with the members. Do they acknowledge that they receive the minutes? How they meet with them? How frequent they meet with them? How's the communication with the department heads and the program directors done with the graduate medical education committee? What is the support from the internal governance of the institution? And how is the communication of the DIO or the graduate medical education with the NIHS? So these questions you need to address during your meeting with the DIO. Next. Yeah. So when you meet the program director, if you are doing the accreditation for a certain program, you can start with the general positive comments and suggestion. What do you think is are the general? What's the strengths of your program? The strength of your resident, the strength of your faculty. Ask the program director to describe the strength of the program, the challenges they are facing in the program, how the program is responding to if there is any problems or there is an incident, how the program director is responding to these incidents or issues in the program. Do they have adequate admin and time support? Do they receive their FTEs being freed? Do they take the head of the department supporting that program director receiving adequate time to be free to do their job as a program director in the training? Relationship with the head of the department or division, you can ask them how's the relationship and how is support of your head of the department in terms of the training. Also, you can ask the training program committee how it's function, the role of the resident in your in the committees and the CCs and the PSC committee, you know, who's the member, what's the minutes. You need to document the minutes that are available. Any action plan is done already for this meeting. You can ask about how his program is running. If there's any portfolio for resident during CCC, maybe you can have a look on that presentation. How's the academic program structure and delivered? How's communication of the program director and the faculty with the DIO? What the support they got from the DIO and the institution, and how they can communicate. Do they communicate direct with the NIHs, or they have to go through their DIO and Graduate Medical Education Office? Next. Toward the meeting with the head of department, just again, always when we start a meeting with any personnel, start to overview what's the strength and the challenges they are facing in that institution or that program. Describe how the program director and how the trainees or how the DIO office, they have adequate support actually for their program director, what's their role as a head of department in supporting actually the Graduate Medical Education Office, the DIO and the program director. What are the resources? Are they adequate actually for that program and available in that department? How faculty has been assessed and reward? And a program that it's good that you ask about the head of department so they know how the report of the program director with that department, and a good get a feedback provided. Do they get a regular feedback from the program director if there is any poor performance in their faculty or a training aspect? And how this performance, if there is any poor performance, how it has been handled. If there is any minutes of theirs meeting with the program director and documented. If there is any action plan actually done, if there is any weakness or any performance weakness and poor performance being documented in the program. Next. Meeting with the resident fellow, very, very crucial. Wherever you do, either you do the institution or the accreditation site visit to meet the resident and the fellow, because they're gonna give you an answer how happy they are from the training in that institution or in that program. So try to emphasize the comment, make sure that you inform them that whatever they're gonna mention in the meeting gonna be confidential and anonymous. We are just here to introduce yourself again and make sure that we are here just to make sure that that your program or your institution is compliant with the standard. This is our job actually, just to inspect this, and how try to look the balance between the strength and areas of improvement. How's the relationship of resident with the fellows and the department heads and DIOs as well. If there is goals and objectives provided to the resident, how it is and how they are meeting these goals and objectives. If there is any supervision policy in that institution or that program in terms of their education and their clinical aspects, and there is any procedural skills observation, you know, there is different type of observation needed. And in surgical subspecialty, we need to make sure that residents have a good supervision when they are doing their procedural skills as well. How it's being monitored, and if there is any lackness or any poor performance, how they has been addressed this. Also about the graduating professional responsibility. We know we need to balance not only for medical education, but also with the other competencies. required by NIHS, which is professionalism as well, if it's feasible in that program, if it's how they address if there is an issue of professionalism. Supervision of the training according to the training level, if it's direct or indirect, and how it's run in the program or that institution. How's the training actually in the program? Do they do a lot of service beside their training? How's the balance actually between the service and that? It's important that we do some service, but we need to know what's the ratio and how it's affecting actually the performance of resident in that department. If they're resident having academic activity and they have protected time, you need to ask them, do you have enough protected time? So what's the protected time? Maybe indirectly you can ask, you have been called during your academic day? If you receive a phone call from ER or from your on-call team, how you react, so you know how usually the academic activity is run and how is the protected time during the academic activities. The training program, most of the training program, they have academic days. So it depends on the program, decide half or day. So you need to find out from the resident how is the academic days running, who is involved in the academic activities. Is the academic activity held and done by a resident without supervision of a faculty or not? It's very, very important to know, because you need to know the quality of the training and academic activities they are receiving. And if there is any assessment tools for the clinical and procedural skills, maybe there is an OSAT forms, one-to-one meeting with the faculty, evaluation at the end of that procedural technique, or maybe they have some simulation labs, so they have been assessed as a resident in these simulation labs. Next. Again, you need to know about day-to-day activities and how's the feedback, end of rotation feedback, how it's done, is it done in a timely manner, evaluation of the training program, end of the program, when there is an evaluation of the program, so it's done once a year actually, rotation evaluation, what's the role of the program director and the faculty in terms of this evaluation. The training environment, how safe is the training environment, and free of any intimidation, or there is any harassment incident in that program or that institution. Try, as I said, with open-ended question, ask about the strength of their program, any challenges they are facing in the program, what they can do to improve these challenges. And also be careful of having one trainee dominating the discussion. Try to take answer from rest. You can choose, like Dr. X or Dr. Y, can you tell me what do you think about this or this component of a training or rotations? Be careful of having one issue dominated at the discussion as well, because you need to address all aspects, because at the end, again, reminder, you're going to generate a report, so you need to address all aspects of your standards. Try to see the body language, when it can give you a hint and a clue how happy is the resident from their body language as well. Try to cover all issue. Do not dominate one area of discussion. And with a closing question, you can ask at the end, do you recommend your training center or your program if there is a new graduating applicant who want to apply or not? It's a good question actually as a closing remark. Next. Meeting with the faculty, again, explore what are the strengths and the challenges they are facing in the training program. Do they receive the goals and objectives of the training program? How is the communication with the head of department and the program director? They have been involved in the assessment of the resident and fellows, and how they receive this assessment. If there is any new innovation, or it's a paper-based, depend what type of tools they are using for assessment. How is the environment and involvement actually of the faculty during the academic days? Are they involved? What were their role? when they receive notification regarding the academic activities, how do they feel that they are important people actually in the program and they have value or not? Do they have any opportunity to attend faculty development during document review? You need to find out if that institution and program keep record of faculty development. Very, very important, actually, apart from the questions, and gonna be part of the rubrics which you need to fill as a surveyor. And you need to check about the scholarly and the safe training environment. You need to see how is the research being conducted in that institution and the program. It's very good that you keep a record of this because it's a part of the mandatory requirement as well. Next. So I think this is going to be my last slide. By end of your visit, I've been repeating this since morning. By the end of your survey, as a team, you're gonna identify the strength and the areas of improvement. You're gonna put in areas of non-compliance based on the scale if they are meeting requirement, not meeting, partially meeting. And you need to provide, when you are doing the report, you need to provide an evidence or a comment on the report, why they are not meeting requirement or why it is not applicable. At the survey, at the end actually of that agenda or that day actually of your site visit, you're gonna do the exit debriefing. If you are doing program accreditation, gonna be with the program director. If you're gonna do the institutional accreditation, gonna be with the DIO. Each area of improvement related to one of the accreditation standard has to be addressed. You're gonna generate the report at the end of your survey, which needed to be signed by all members of the surveyor committee team before leaving the institution. You will not convey any message regarding the final decision of accreditation. You're gonna just, once the report is being generated, you're gonna send it to the NIHS Accreditation Committee. You will not disclose any recommendation either to the DIO or the PD. And it will be a final decision of the Central Accreditation Committee to decide about the status of the accreditation, and they're gonna communicate directly with that institution or the program. And I think I will leave the floor now for Dr. Mohammed to go through the journey, how to take a decision regarding the institution accreditation. Thank you, Dr. Mohammed, for the opportunity.
Well, thank you, Dr. Mariam. That was really thorough, and I really enjoy it. You're speaking of experience and expertise, and I really like the presentation. And what we'd like to do here, we'd like to unify the assessment. And that's why we insisted that all the surveyors who are applying to the National Institute should go through the workshop, so at least we speak the same language. Is very important. So I have just 3 or 4 slides to talk about what's next. So the output of the surveyor report. So the surveyor report providing a very important assessment to determine whether the institution or program is or is not in a substantial compliance with the NIHS accreditation standard. Most of the time, the surveyor's team will submit a detailed report to the Central Accreditation Committee through the accreditation unit. The report will be signed by all the participated surveyors. The Central Accreditation Committee will study the accreditation surveyor team report and may invite the member of the team to attend its meeting to explain or answer questions. The committee shall also request any additional documents or statements from the health establishment or training center. The accreditation decision will be made by the NIHS based on the recommendation of the Central Accreditation Committee. Next. So the Central Accreditation Committee has the right to accept or reject the accreditation surveyor's report, and after the full justification, reconstitute the accreditation team and determine a new site visit to the health establishment or training center if needed. After reviewing the auditing, and the Central Accreditation Committee issue its recommendation concerning the institution or program level accreditation decision and submit them to the Secretary General through the chairperson of the committee. Next. Now, this is, I received many questions. So what are the accreditation decisions? So there are multiple options here that we have. And again, it's all based on the surveyors and the Central Accreditation Committee. It could be a decision to grant institution or program level accreditation for 5 years, or to grant a conditional institution or program level accreditation, or maybe not to grant accreditation, or to notify possible freeze of accreditation. And this is when it comes for maintenance of accreditation or renewal, decision to withdraw accreditation, or to modify training capacity in cases of program level accreditation. Next. Okay, well, I see more than 23 questions coming on the question and answer. And I think we do have time ready to go through all the questions. Some of the questions we did answer it through the question and answer. So please, if you have question, type it on the Q&A. Don't type it on the chat because we don't look at the chat. You could also, if we have time, we can take also people who raise their hand, but I would suggest to type your question. So I can read a question here. I see a question from Dr. Lakshmi. How long will the institution accreditation valid for? Again, if it meets all the criteria, it will be for 5 years. Yes, correct. And another question who said, I speak on behalf of some of attendees today from different hospitals. We highly recommend a letter from NIHS to Surveyors Hospital on requesting surveyor to participate in accreditation. That's what we do actually. So far, we have at least 2 institutional visits, and we did request from the health authority to free the surveyors, and yes, they were granted a business day off to perform the institution visit. So we do this already. Another question here from Dr. Hassan. Meeting with the trainees and trainers is based on individual meeting or meeting with a group of trainees? Well, this is most of the time, as Dr. Mariam said, it's based on a group meeting. And then Dr. Amna Shamsi is asking, any application request to be checked by Secretary General for institute eligibility? What is excluded criteria? So Amna, I would highly recommend you, please visit the NIHS website. We do have a clear document on the institutional requirement as well as the common program requirements. You can go through it just to know what are the criteria. So let's see here, what is, oh, okay. So Amina is asking, she said, what is a percentage of standard to be met to decide for a partial met validation? Well, it's not about a percentage here. Now, there are fundamental area within the accreditation that should be met. Now, it could be not 100%, but partially met. We need to have a clear plan from the institution before we decide on a partial accreditation. And that would be, again, a decision of the Central Accreditation Committee, and it's all depending on the findings of the surveyors. Now, Charo is asking how much time it takes to become a certified surveyors. Maybe I'll ask Mariam to answer this question. Mariam, would you like to answer Charo's question?
Sure. So as we mentioned earlier, there is a workshop for you as a surveyor to attend. Once you have been selected, if you already applied and you know your roles, you have been applied. If you have been interviewed already, you're going to attend actually the workshop for the NIHS surveyor group. And I think from the first time you can go, you're gonna be ready after the workshop. Like for me, I never did an institutional work visit, to be honest. I'm a program director, so I've mainly been involved in training, inspection or accreditation stuff. I did internal reviews, but after the first meeting actually and the workshop, I think I was ready. And thank you for the trust of the committee who see that it depends actually what's your background based on your CV, the amount of the assessment you have previous experience actually, and based on that recommendation gonna be good. Because again, if you have an experience already in the medical education, you're gonna have an idea how to do, because you gonna have a list, you're gonna follow that list. It's ready already for you. If you attended a workshop and you know all these aspects and rubrics, I think you're going to be ready from the first one. It's not that difficult at all.
Mariam, there's another question from Dr. Hisham Marghani. He's asking how to assess institute and GMAC activity and merit for institute applying for the first time. So it looks like they're applying for the first time and they don't have yet a GMAC activity.
So for the new institution, they need to have a form of the GMAC. They need to know that they need to select people who are the members. They should know who's the members, and they should know how they do communicate with the members. They just need to have forms available, and they should know what's the future plan. If there is an action plan, how they're gonna address it, they should be aware. Even if they are newly applying for accreditation, the institution for accreditation, they should be aware about the general forms, which is actually gonna be provided for them. Samples gonna be provided. So this is a basic requirement needed. You don't need to review minutes because it's a new accreditation. So just they need to know the forms and how they're gonna do the process in future.
Mariam, another question from Dr. Hassan Al-Bess here. He said, based on his previous question regarding meeting with trainees, if meeting done in a group, how can we be sure of confidentiality and bias we received from them?
So if you are doing a meeting in a group, we never ask them, they just introduce their name. It is your job actually of the surveyor to make sure and convey this message to them. Whatever in the meeting here, it's confidential. And whatever they want to, by the way, if they think you are safe and you are kind with them, they're gonna talk. And this is what you want to know actually when you do in a group meeting. Because we don't know who created this group, gonna be a selection from the program director. I saw this in one of the questions as well. It's gonna be selected based on availability of that faculty or residents. So you need to make sure that this information is confidential. It will not be utilized outside the facility. It will just be delivered to the NIHS, and whatever they can mention that incident, or they can mention the areas of weakness and the strength without mentioning names of certain faculty stuff. You don't need to dig deep actually and knowing who's the certain people or the certain person who have an issue in that institution or that program. But you need to make sure that whatever they mentioned gonna be confidential, and we will not mention the name of that resident who stated this statement actually.
Okay, so another question here, again regarding, it looks like it's all about the trainees. Who will choose, this question from Al-Khansa, who said, who will choose the trainees or fellow for the interview with the surveyors?
So usually it's a program director rule to choose the trainee from different levels. Also going to be based on availability. Suppose maybe some resident going to be on leave. You cannot force them to come to attend that meeting. But who isn't available on that level has to be attended. And it is a selection from the program director.
So she's asking, why not doing it randomly from the list of trainees?
Well, you can choose randomly if you want. There is no specific criteria, to be honest, as a program director when we choose our resident. Like I don't choose, sometimes you might have a resident who's an issue. I don't mind to choose him in the interview. So they have the right to be chosen as well in the interview. Yeah.
Okay. So
if I might just intervene here, Dr. Muhammad.
hold on, Dr. Sheikh.
Yes, I think the whole process of assessment is as mentioned by Mariam and Moza, developmental and collegial. What we would like to ensure in the NIHS is to have a mix of residents, so representation of different levels of residents. And then also we are keen to have the residents who are part actually of the GEMIC or other committees in the institution. So in that vein, we leave it to the DIO with the program directors to select a mix of candidates who would represent the residents. If we opt to select them randomly ourselves, we might miss the senior residents who are part of these committees, and therefore we miss an important dimension about the reflections from the trainees. That's the case. Thank you.
Well, thank you, Dr. Sheikh, for the clarification. I have another question from Professor Mahideen. He said, is there any difference in the process of new institution willing to start residency versus old institution who already have residents in place? I think this is really a good question.
Yeah. So since this is application for the NIHS, all the groups gonna have a new accreditation. Even if you have been accredited by other bodies like Arab Board, Jordanian Board, there is a requirement, certain requirement you need to meet. Either you have been newly in the process, or you have been accredited by other bodies. You need to meet a requirement regardless. And we don't, as Dr. Moza said, we don't look to any citation or internal review done by that body, that accredited body. It's not our job. We are here just to make sure that you are meeting the requirement requested by the NIHS. It doesn't matter if you have been accredited by all bodies or you are just applying from the start to as a new accreditation, or you never been accredited by Arab Board or Jordanian Board, and you want to start directly with the NIHS for the Emirati Board. It doesn't matter. You need at the end to meet the minimum requirement of the standards of the NIHS. It will not affect. Correct me if I'm wrong, Doctor. Yeah.
Yeah, just to add for this question about institutions wanting to apply and they don't have programs actually running. That's okay. They can apply and they can, it will be clear from the application that they don't have a program, but they are planning to establish new programs. That's okay. And they have to, to answer the questions accordingly. Whatever their plan, in which way they can do things, they try to fulfill the standards in answering these questions, and we know that these are future plan, and such institutions will be visited as well, and to make sure that these institutions they are good enough to start initiating new programs. So it is totally acceptable for institutions who doesn't have any programs to apply.
Yeah, one more addition to your word, Dr. Moza, sorry. Also, maybe that institution want to be a site institution for any integrated program. You don't need to be the main institution. So you need to meet the standards of the NIHS as well. So yeah, it can be one of them.
Sometimes it's a good idea to integrate with another existing program. This is really excellent suggestion, and this kind of negotiation can be done as well at the level of the NIHS. The NIHS, they can, guide them. Okay, you have such interest. How about that you communicate with another program which exists maybe in the same emirate, and try to be part of this program as a starting point, and maybe later in the future, once you get the experience, maybe you will start your own program. So it's a good suggestion. The other thing I think to comment on the question of Dr. Hisham, yes, there are some of the institutions, they don't have a background in relation to the ACGMEI, those, hospitals and programs which have been accredited already by the ACGMEI, I think they have, you know, a better chance to reach the standards. However, there are institutions and programs, they don't have such experience. What I would suggest, communicate with your colleagues who have been accredited previously. Find out if they can share with you some of the documents. There is no harm, actually. What I know, for example, in the US, they are sharing the BIFs among themselves. I mean, between programs. If I have a colleague somewhere else and they want my BIF, that's totally acceptable. You can find a lot of you know, resources in the internet. You can even, some of the BIFs are already published in the internet, and it might include the answers to many of these questions, just to give you an example how you can answer the questions. So sharing the resources with your colleagues is totally acceptable if the management of that institution is all right with sharing such resources.
And if I might come here, I would like also to state that having an experience like ACGME accreditation is certainly an asset, but it's not a must. We, in the NIHS, we have our own standards, and these standards are communicated to institutions. What we want is the compliance of the institution with our standards. So as long as the institution that's applying fulfills our standards or local standards here, they will be okay. And in terms of the new institutions with no previous experience in residency, as my colleagues mentioned, there is no problem at all. The application of the standards is contextualized. So we would like just to see the readiness of the institution to organizing and running a residency program. And therefore, we will check along the 5 dimensions, the readiness of the institution. And what we will miss is, for example, the feedback from residents. For example, if residents are not there in the hospital, that's only one dimension. But I fully agree with Dr. Musa and Dr. Muhammad and Dr. Mariam that we welcome new institutions who are applying to us for accreditation.
Well, thank you, Dr. Sheikh. I have here a question from Dr. Manzoor Ahmed, who's heading the Radiology Scientific Committee, and is asking, is specialty program, PIF, and rubrics formulation responsibility of Speciality Scientific Committee or already present from NIHS or ACGME? So this question, maybe Dr. Moza can answer it because she's working on the PIF and rubrics.
Yeah, the scientific committee are involved, actually. They are the one who are providing the BIF and the rubrics. And we review them in the subcommittee in the presence of the chair of the scientific committee. So the radiology program should be, it's among the programs in the pipeline, and they should communicate with us their BIF and their rubrics, and they need also to review the common to make sure that there is no repetition of questions between the specialty and the common program form. Yes, that is the responsibility of the scientific committee of the individual programs. Yes, this is true.
So Dr. Manzoor, just since your committee will be responsible for putting the accreditation requirement, it will be the right committee to also work with our accreditation committee and put the PIF and rubrics, because you'll know it more than anyone else. The beauty that we already have a general, again, program requirement and templates available. We have at least now 8 specialty PIF and rubrics available, and we're hoping that in 2 or 3 weeks, radiology will be next. So thank you.
Yeah, and he can have my telephone number. I will ask Wafa to send it to him, and he can call me actually to arrange for this, and if he has any question, because ultimately he will have to submit it to our subcommittee in his presence. We need to discuss this in his presence.
Excellent. Is that Dr. Sheikh talking or? Okay, so another question here, or maybe a suggestion, it looks like a suggestion from Dr. Tariq Shahrour. He said, should the resident be peer selected? What do you think, Mariam?
I think it has to be selected by the program director as the or the DIO when they send the notification to program director in terms of accreditation of the institution, because resident might not know that important that resident who's involved in committees has to be selected. So they might not select these people. So they might miss a major component required actually for that assessment to be done.
I have a question from Dr. Riyad Hussein. He's asking, are the surveyors going on the same day or everyone is going on a day?
So as I mentioned repeatedly in my meeting or in my slides, the Central Accreditation Committee gonna provide the number of surveyor who gonna go and conduct the survey on that day. So you're gonna go as a group, 2 to 3 surveyor same day to interview, and you're gonna share the job and the role while you are doing the survey. So all of them in the same day. You don't do in separate days. It's in the same day. Yes.
Okay, excellent. So I have a question from Dr. Yusra Al-Ali. She said, I would like to ask if we have criteria for a subspecialty program, but DOH does not agree with that. I can answer it that most or almost all our criteria are available on the website and was circulated to all health authority. And the beauty about what we're doing is if you look at the level of the board of director and the advisory committee, we do have members representing all health regulator in UAE. So our standards has been agreed, circulated among all health authorities, as well as members of different scientific committees, and there's no conflict, I can assure you. Excellent. So I see now, I don't have more questions on question and answers, but looking at the chat, I see people are asking about the presentation, and Wafa is sharing the link to download the presentation. We're also recording the presentation, and it will be available on our website as well as on our YouTube channel. So it will be available for you because again, it's rich with a lot of information from the speakers. Thank you. And yes, you can use it as a reference. Okay. Also, again, within the website, you'll see a link on how to apply if you would like to be a surveyor for the NIHS. So far, we have 30 approved surveyors, but I guess we need more because we started receiving applications, as I mentioned, from institution. And I think within the next month, we will receive more application at the program level. We're hoping that, inshallah, this summer, we will have our part 1 examination only for the accredited programs. Okay, so if there are no questions, let's see. No, I don't see any questions. Dr. Mahmoud Sheikh, the accepted residents, doctors, medical school graduate or so Dr. Mahmoud Sheikh is asking about the accepted residents. Are they only from medical schools within UAE or from abroad? And maybe I can answer this question. Dr. Sheikh, so the National Institute for Health Specialty is a regulator body. We're not a training center. So what happened is there are many international graduates who wish to apply, and they can always apply. They will go through the Emirates Medical Residency Entry Examination, which we conduct every year from December till March. Once they pass the examination, then they can apply to the health authority directly, so they could apply to DHA if they would like to do in Dubai. There's a matching. We have a national matching, and they can apply directly, whether they are graduates of UAE or from abroad. Okay, and I see a question from Nepta, Dr. Nepta. Often listed within existing universities are institution and program, for example, the Institute of Public Health with postgraduate program. Since there's a direct pathway for accrediting program, how does the accreditation process, does it need to be staged? I don't understand it. Well, Dr. Nepta, we're different from academic accreditation. We do professional accreditation, which is totally different from what the CAA is doing for PhD programs. I hope I answered your question. Dr. Hisham Marghani said, thank you. Great meeting, very useful. And Dr. Mahmoud Sheikh said, thank you again. It looks like we did answer the question. Okay. Let's see. Well, again, 3 hours on the weekends, and I see 65 participants. Thank you very much. Thank you for your time. Thank you for your interest in joining the NIHS, in learning about our accreditation standards, and learning about the institution process, and willing to participate as a surveyors. Please do not hesitate. There are things that I would like to announce. We will have 3 workshops coming soon, actually within the next week. One of them would be examiner certification. These 3 workshops would be based on demand. It would be available on a platform in collaboration with Saudi Commission for Health Speciality, where you can access it at any time and you can learn how to sit a clinical examination, assess clinical competencies, and learn more about examiner behavior. We'll have another one on case designer certification. Again, it would be through e-learning program with 2 phases, and a 3rd one on item writer. So please visit our website. I'll try also to send you emails with invitation to these 3 e-learning workshops. Thank you very much, and take care. Enjoy the weekend. And thank you for the speakers, Dr. Mariam, Dr. Mose, Dr. Sheikh, and Wafa. You've done an excellent job. Thank you.
Thank you, Dr. Ma. Salama.
Nice.